morning, friends. Myself, Dr. Shrinivas Sangnor. I'm a physician and intensivist at Bhagwati Multispecialty Hospital, Nanded. Today, we'll discuss the topic hypertension. Our today's discussion will be on what is high blood pressure is and how to prevent it. Generally, everyone would like to have a healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates a pressure against the walls of the blood vessel. This is called the blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to a serious health complication. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, and stress. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries can stiffen up and narrow up as excess fat builds up. Next risk factor is family history of high blood pressure. One or more close family members with hypertension increase person's risk of developing this condition. Next risk factor is excess salt intake, is also known to raise the blood pressure. Next one is not eating enough food with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Next one is eating processed and fatty foods. Increase the fats throughout the body and make the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also the link to obesity and further to high blood pressure. Next risk factor is stress. Reacting to stress is unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious signs and symptoms. That's why it's often called as a silent killer. It puts people at risk of several diseases, from cardiovascular problems to kidney failure, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis is very important in managing hypertension. Measuring blood pressure is the only way to know whether the person is high blood pressure or not. Generally, when symptoms do occur, they include what are the symptoms? Morning headache, tiredness, vision changes, buzzing in the ears, fatigue, nausea, or vomiting. If person is experiencing some of these symptoms, then one should get the blood pressure checked. Fortunately, high blood pressure can easily be diagnosed. It is usually measured with the instrument called the sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's try and understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 by 80 mm of Hg, or it can also read as 120 over 80 mm of Hg. Here the upper number indicates systolic blood pressure, which means pressure in the blood vessel when the heart contracts, whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessels when the heart rests between beats. If the blood pressure is more than 140 by 90 mm of Hg, then the person have hypertension. If a person have a blood pressure level higher than this, then he or she might be at risk of developing serious heart disease. This risk can be prevented by reducing or taking steps towards the healthier lifestyle. What are the healthy lifestyle? Number one is the regular exercise. Next one, healthy diet. Next one is regular blood pressure monitoring. Next one is stress management. And next one is adhere to medicine. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid, delay, or reduce the need of medication. So let's take a look at these strategies one by one. Number one strategy is regular exercise or physical activity. Exercise can be drug-free approach to lowering blood pressure. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessels will decrease and lower the blood pressure. In other case, as we are aware that age and weight gain are the two major risk factors for high blood pressure. So if blood pressure is at desirable level, that is 120 by 80 mmHg, then exercise can help prevent it from rising as you age. Regular exercise also helps to maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most of the weekdays. High blood pressure level can be reduced by doing regular structural exercises such as brisk walking, jogging, swimming, etc. Next one is healthy diet. Diet also plays an important role in controlling the blood pressure. A diet with high intake of the vegetable, fruits, whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adapt dietary patterns such as DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in the diet, and limiting alcohol consumption. We will see what is DASH stands for. Delivery dietary approach to stop hypertensive diet. Eating a DASH diet that is rich in whole grain, fruits, vegetables, and low fat dairy products and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 mmHg if having a high blood pressure. Next one is we have to reduce the sodium in our diet. Even a small reduction in sodium in the diet can improve the heart health and reduce the blood pressure by about 5 to 6 mmHg. If you have a high blood pressure, to decrease sodium in your diet, you can consider tips like we have to read the labels on the food. If possible, choose a low sodium alternative of the food and beverage you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in the food. Most sodium is added during the processing, so you can eat natural products. Don't add salt. Just 1 level teaspoon of salt has 2300 mg of sodium. Avoid adding salt to food. Use herbs and spices to add flavor to your food. Next is we have to quit the smoking. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Next is regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by using doctors, but it is not always possible for patients to visit doctors and to check for blood pressure. Hence, most often I advise them to self-monitor at home. Self-monitoring helps person to measure blood pressure at different times throughout the day and over a long period of time. It also assists doctors to get more complete picture of person's blood pressure readings at different times. Further helps us in better prediction of the cardiovascular morbidity and mortality rather than single reading. Routine blood pressure measures that occurs during the clinical visit. Next is stress management. By learning how to relax and manage stress can improve emotional and physical health and lowers high blood pressure. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful, and meditating. Next one is adherence to medicine. A medicine to lower blood pressure may be recommended by doctor. If your blood pressure is consistently high, usually at above 140 by 90 mmHg, adherence to medicine is very important. It controls blood pressure regularly. At least I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventing care.